Hello, everyone. My name is Joan, and I am a fourth-year medical student at SUNY Upstate Medical University in Syracuse, New York. Thank you so much for taking the time to listen to my presentation today. As many of you have probably experienced for yourselves, the COVID pandemic really has put our problem-solving skills to the test, both as individuals and as communities, as we strive to find different ways to provide the best care for our patients while maximizing the use of our medical resources and minimizing the amount of waste in the process. One of the key components to this challenge is to establish effective screening protocols that we can use to triage patients as they come through our doors and determine whether there is a COVID infection that needs to be ruled out and that the patient needs to spend some time in isolation rooms, or whether the patient is probably coming here for a lower risk reason unrelated to COVID and could probably be assigned to a patient bed that had looser isolation protocols. This really helps to control and limit the transmission between patients and healthcare providers, and it really effectively helps to ensure the safety of not just our patients, but also the healthcare providers as well. At our institution, what we have done was implement a protocol that comprised a list of COVID site triage criteria, which is essentially a list of presenting symptoms that are most common to those presenting with a COVID infection, and any patient that comes in with a symptom that is listed in the criteria below would be assigned a room on side B of our emergency department. Those are usually individual patient rooms with effective isolation capacity, and the remaining patients with no symptoms that suggest COVID infection would then be assigned a patient bed in the low risk area. We retrospectively looked into our electronic medical records, and we looked for all encounters that had a COVID suspect, exposed, or infected diagnosis, and determined which area the patient was roomed in for that particular encounter. We found 244 total data points, and 40 of the encounters were triage to the low risk area. That suggests initially that our screening criteria is about 16.4% mistriaging our patients into the low risk side where they really should have been put in isolation rooms. We wanted to figure out if this really was a true number or that there were other factors in play. And so we looked into first how many COVID tests were ordered in these low risk areas, suggesting if we were really questioning our room assignment, our bed assignment. And we found, unfortunately, that there were 11 out of the 12 COVID tests that returned positive. However, this really was revealing a limitation of our study and a problem with our design, that if we were to redo or to improve on our study could be taken into serious consideration, which is that 10 of the 11 positive test results were from trauma bay rooms. And this really is an issue of the design of our emergency department, where the trauma bay rooms were really next to the patient beds that were divided only by curtains and thus assigned as our low risk area. And so in tabulating our encounters, the trauma bay was lumped together with low risk area, which is not really the case in practice, because trauma bay rooms are isolated effectively from the outside area and contained in a very limited space. And so taking that limitation into consideration, really only 2.5% of all of our mistriaged cases were truly an actual mistriage, and taking into consideration all of the encounters that we were looking at, that's really less than 1% of mistriage into a low risk area. And so all in all, I think our screening protocol did a pretty good job, obviously with lots of lessons that still need to be learned and can be taken with us as we continue our healthcare journey and encounter any other potential similar situations such as the COVID pandemic. I hope some of this data and information was helpful to you in some way, and thank you again for your time and interest in listening to my presentation.